You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Steinberg. Dr. Steinberg, welcome to the program.
Thanks for having me.
All right, now before we get into today's topic, I have a lot of questions, especially for the denture wearers. Tell me a little bit about your practice for those that don't know you. Who's your typical patient, and what are the different procedures that you do?
Well, I really don't have a typical patient. I have patients that come in with corporate jets. I have patients.
Is that right? They fly in to see you.
I have people that come from the Philippines and all over Arizona, Flagstaff, Yuma, Phoenix, but I live in Tucson.
Okay.
And I have people that, but I have firemen, I have policemen, I have teachers, I have people that are minors, I have people that really are, you would not think they could afford to do any dental work, but they come to see me because they want to get, to fix their mouth and to get health again in their whole dental situation.
So the procedures you do, though, as a prosthodontist, what are they?
Well, I do veneers, and I do dentures, partials, crowns, and then I do dental implants, and I also do very complex things with dental implants, changing people's whole, they're giving them totally new teeth.
Okay. What's a maxillofacial prosthodontist? Am I saying it right? Maxillofacial prosthodontist?
Yes.
How does your training differ? Okay, so after dental school, what happens?
Well, after dental school, I did 3 years of advanced training in a residency.
Okay.
And I did a 1-year fellowship after that, doing advanced training. And the maxillofacial prosthodontics is the same as prosthodontics, doing advanced dental work, but I was given more training in doing anything artificial for the head and neck.
So making teeth?
Not just making teeth, we did eyes, ears, noses. I did a lot of artistic type of things, working with patients, cancer patients, congenital abnormality, and accident patients.
Okay, now you are head of a study club in advanced dentistry in Tucson.
Yes.
And you lecture on the road as well.
Absolutely.
Quite a bit.
Yes, I do. And
what are your topics?
I do topics from cosmetic dentistry, dental implants, advanced dental work, prosthodontics, certainly.
You spoke last night?
Yes, I did.
What was the topic?
Last night I spoke about dental implants.
Dental implants.
Some of the new advances, immediate implants, and some of the new things that we can do just to change people's lives in one day.
So things like teeth in a day for denture wearers, or teeth in a day period, I mean that's real. That's not just a slogan. That can happen.
Well, that's we do it all the time.
Is that right?
Yeah, absolutely.
Right? So what are the different types of, or categories of dental implant patients that you see?
Well, I see people just for one tooth. I see people that have multiple teeth, that maybe a bridge, or just want to have 3 or 4 teeth.
Okay.
And then I see people that need their whole mouth, where they have lost all their teeth, such as denture wearers that have been wearing it for maybe 30 years, or they've, even people that are just maybe the last 10 months, they've just had their first set of dentures. And we see people that have just tremendous needs in addition to what we said before.
Now, dental implants have become mainstream, right? I mean, for denture wearers, I mean, it's happening across the country now. I mean, the future of this is no more dentures. Is that true?
There's millions of people right now in the United States that are wearing dentures, and that should not be, in my opinion. I think it's very sad that these type of people are wearing dentures that really are not anywhere near what it can be if they just had even a few implants in their mouth.
Is it true, by the way, with just 2 implants, you could give something that snaps in, snaps out, no adhesive?
Well, with even 2 implants placed in a patient changes their life. They can hold their teeth in, they don't have them fall out, they can go out and kiss their wife or their husband. They can do all kinds of things that they can't do with regular dentures.
But if it's as good as you say it is, a denture wearer getting dental implants to give them something fixed in their mouth, why isn't everybody doing it? Why aren't all the denture wearers doing this?
Well, I think the real reason they don't come in to do this is because they're not seeing dentists. They at this point in their life, they think, I don't need a dentist. They don't go in for hygiene. They don't see dentists routinely.
So they don't know their options.
They don't. And things have changed so dramatically that what they think could be done for them is nothing like what's real to them.
But isn't it painful, though? I mean, it seems very painful.
No, actually, dental implants are remarkably not painful. My average patient, when we do dental implants, takes a Tylenol and Advil that night, and the next day they don't need anything. So that's not a problem. And also, with the technology we have today, anesthesiology, sedation, the procedure itself is really not difficult at all. In fact, it's really easy.
Why is it what used to take you guys, like let's say 9 months or 12 months, now you guys can do in a visit or two?
the imaging has
Oh, is that
really
right? Okay.
has really changed our concepts, because now we can see what someone has, where their nerves, where their bone is, etc. Plan our surgery up front. We know exactly what we're going to do, and with guided surgery, we can put implants exactly where we want to put them.
So is it very little trauma? Is that true? Very, very little trauma to the gums now? Because the bone, I guess, doesn't have feeling, but the gums just...
Well, that's exactly correct. The bone does not have feeling, but the gums is the only part that really feels anything. But today we do implants similar to laparoscopy, where we can just numb someone, just place the implant right where we want them to be, and not have to make big surgeries like we used to do.
Now we should mention, I mean, you are one of the guys that was, you know, like in the first class, I should say, of dental implants, right? I mean, you've been there from the onset.
Yeah, I was very
is that
lucky.
right?
Yeah, absolutely. I got when I started with dental implants in 1980. I started my residency, and we were doing an implant that's no longer done. But the training and the basic type of implant is very similar to what's done today. So I had a chance to do surgeries that were really complex.
So it was unheard of years ago that you could go in and get an implant, get the teeth on the same day.
Well, no,
and leave.
it took a year. I mean, it took months and
But there's still
years
guys doing
to do
it the old way. Is that true?
I'm afraid that is true, and I hear about all the time how people tell me they went to someone and it took
Is that why
6
people go
months,
to
a
your
year.
courses, by the way, to learn this all-on-4 procedure?
Certainly, I teach dentists, and I try all the dentists to learn what's going on, what our new technology is, and how we can help our patients.
You say it changed their lives.
Oh,
Just getting their teeth back.
well, it's unbelievable.
Like what? Like what?
When someone gets dental implants, particularly like an all-on-4 where it's fixed, they can eat anything. They have total comfort. The teeth don't move. They're able to do things they haven't done in years.
Do you have a bias, by the way, that a prosthodontist is really
Yeah,
the
I
best?
do. Well,
Do you? I mean, do you kind of?
there's great general dentists, but prosthodontists take much more advanced training, and we do it all the time. What we do as specialists is advanced dental work every day. So we're seeing complex things. I'm looking for the artistic work involved with patient, and that is really the most key difference, in my opinion, the most key difference between someone with advanced training is their ability to have an eye for it, to be an artist, to actually make the patients look, so that you mentioned before, natural. They need to.
I saw your photos, by the way, and they're nice. They're very cosmetic. It looks like just cosmetic dentistry. Now, does somebody need a referral to see you, or does it cost more to go to a specialist for dental implants?
Well, actually, most people go to a surgeon, and then they go back to their dentist to do the work.
There's 2 people involved.
Yes, and I do both. I place implants and I restore them. So it's really, I don't know if it's less, but it's certainly no more to see someone that's doing everything for you.
Now, what are the age ranges of these dental implant patients? Like
Well,
the denture wearers? Well, I mean, how old are they?
Denture wearers or
Well, the people that you see.
Well, I see patients come to me young. I mean, I have teenagers that come for dental implants. But if you ask me when they really start losing teeth, the ages go from really 30s to 90s.
90s.
Yes.
You've had people 90 years old that you've given dental implants. Why would a 90-year-old want dental implants?
Why would a 90-year-old? Because, well, just like yourself, don't you want to have teeth your whole life?
Okay.
I mean, I want to have my teeth my whole life. I plan to be around into my 90s, and I want to be able to go out and eat with my family. I want to be there and be comfortable. I want to have self-esteem to go out and smile and know that I have something secure in my mouth, and that lets me function and do great.
You have photos.
Yes, I do.
What'd you bring?
Well, I actually, well, I'll start with this gentleman here.
Okay. Oh my goodness.
And this guy's he's actually in his upper 30s. He's a handsome guy.
That's a 30-year-old.
That's a 30-year-old. Well, this gentleman, he came to me. He actually came from Phoenix, and he's just had tremendous dental issues. He's hated to show his teeth. He never smiled at all. His wife actually brought him because he had been complaining to her, but no one else about.
Is that common, by the way, to see that?
Well, you don't see that, but I see it all the time. The patients, don't smile. They walk around. They hold their. They just sit. They don't show their teeth when they know that it looks like that.
You look at this. What has to be done?
Well, he had many problems with his teeth, but his upper teeth, he had gum disease. He was sensitive to hot and cold. He had decay.
So they all had to go.
For him, we extracted teeth, and he could have had dentures. but his young age, and actually, as you know, anyone, I don't want them dentures. This gentleman, we took him and we decided to place implants, and we made teeth that stay in his mouth and don't come out, and we put them in the same day.
Okay.
And I think it's just remarkable, the change in what he looks like now.
Let's take a look. Oh my goodness.
And now you can see what he looks like now.
You can see he is a young guy. Okay, so those are all, that's implants.
We placed 4 dental implants, and we were able to screw teeth in that stayed in his mouth the same day. And in fact, when he came out after doing it the whole day, his wife looked at him, she started to cry.
Really?
She was just beside herself because, she knew for so many years he would not smile. He wanted to change his whole looks and smile, and this did it. But more important than smile, he can eat anything. He went home that day and was able to start to eat, to function, and to do things he hadn't done in years.
Are there a lot of guys like that, by the way? I mean, in Arizona, would you say that there's thousands of these people?
Well, at least thousands. I mean, I don't know the exact numbers, but there's so many people in not just Arizona, in the whole United States, millions of people that have this similar type of problem. So let me show you another case.
All right, all right.
This lady here.
Okay.
And she came to me, and she was sent to me for dentures, and she actually was told you can't save anything.
So the general dentist sent her to you for dentures. Interesting.
The general dentist sent her to me for dentures. Let me show you a closer look at her teeth.
Oh boy.
And these teeth were really they looked terrible. They were moving. They were out. There were spaces. But when I saw her, I said, I can actually fix all your teeth if you like. And we went through it. She was prepared just for dentures, but with just a few dental implants, some crowns, and keeping all her teeth, we totally restored her smile.
Now, is this a woman then?
And wait till you see how she looks.
When they come in with smiles like this, is it tough for you to even get them to smile? I mean, are they ashamed or embarrassed?
Oh, I know. My first pictures normally are terrible. In fact, when they first get the teeth, I like taking pictures a year later because then they're relaxed. But when I first take a shot, they don't want to show them at all. They hate having me take their picture.
Okay, okay.
They look at me and they're like, you're going to take my picture? No one takes my picture.
Is that right? Is that right?
They hate.
Okay, so for her, what'd you do? So you did.
Well, for her, we actually took here you can see her smile.
Oh my goodness.
We did implants. We did crowns. We totally restored, opened her bite.
Wow.
And now you can see she has all her teeth now. They don't come out at all. She can eat anything. She feels confident. And what's really neat is she becomes a great dental patient. Here's someone that hated going to the dentist. That's how she got that way. Now she loves coming in the dental office. She's not fearful. She doesn't have any problem seeing us again. In fact, we become really good friends. She's a wonderful lady.
So they start brushing and flossing, and
they do all the things.
Like a second chance.
They do all the things they should have done years ago. They start to take care of it and really care about their mouth.
It's very interesting. It sounds like an exaggerated story almost. Somebody sent to you for dentures, and now she's
No, this is common. We see people like this all the time.
And now she's got a...
And actually, that's the most exciting part of my job, is that when I see people and I can, immediately they sit down, I can tell how I can change their life and transform them into a whole new person by changing your smile, by changing your ability to eat and function and have... and have comfort again.
Are you ever surprised, by the way, with the transformation?
Well,
giving some of these teeth back does.
I think I'm excited by what we can do, and it's always.
I mean,
I'm very proud also that what we can do for people to help them today. It's really moving, and many of the patients give you big hugs the minute they get their new teeth and realize what a major change it is in their lives.
And by the way. With this woman, so she just cares for them just like her regular teeth.
Yeah, these are regular. There's no difference now between these and regular teeth. She flosses them. She comes in and sees her hygienist. These are teeth in her mouth, just like any other tooth.
Okay. Okay. Now, over to the denture wearers again. You brought some models. What are the options? Okay, so denture wearers watching this. What are their options?
Well, the denture wearers. This patient came to me. And she was uncomfortable, she was hurting, she couldn't eat anything very well, but she adapted, but she was adapting living on a soft, mushy diet.
Okay.
And so when she came to me for new dentures, and I actually recommended that we consider some implants and do some work.
All right.
And so she did. And I think you can see that this really totally
very nice
changed her whole not just her smile, but her whole face. If you look at what you can do, just changing the bite and getting everything lined up right, it allows people, I think, to look much younger. It lets people be able to go out and smile and be with their friends and have self-confidence.
Now, you were on TV with this woman, you said.
Yeah, this patient actually is an artist, and she came on television with me talking about me being an artist, and she's even on my webpage, and she talks a little bit about about her experience in her office.
Now, there's a lot of art to this, you say?
Oh,
what makes up a good smile? I mean, when I look at that smile, what makes it a good smile, in your opinion?
It's hard for you to see this, but when we're doing the design and following the lip, having the teeth go off in the distance exactly like it's like a train track going off in the distance, and that's artistically done. We do that. Actually, I do most of that myself, setting the teeth and putting them in the right position. So the teeth
kind of follow that lower lip.
They follow the lower lip. You'll notice the centrals are the longest tooth. They're wider, and then it goes smaller. In fact, there's a proportion that we use for that, just like plastic surgeons.
Do they have any say-so, by the way? I mean, do you give them an idea of what their smile's going to look like?
Every patient's different. Every patient, a lot of our patients bring their friends. They bring their daughters, their mothers, et cetera, and someone they value their opinion, and we look at it all together. And my dental assistants, we all work together because we want our patients to get the best result they can have.
Okay, now the models. You brought the models because I want to ask you specifically for denture wearers. What are their options?
Well, we have a number of different options.
Okay.
You see how tight these are.
Okay, all right.
We have for people that have just pure denture, just having 2 dental implants, you can see just 2 implants placed.
So that's like a lower jaw.
This is a lower jaw.
Okay.
And this could be in the upper too. This is called a locator attachment, but there's a number of different snap type of attachments, and we can make a denture. You can see like little attachments that are in here, and when we put them on, and the patient puts this in their mouth, they snap it.
Let me see this.
Is
this an actual, like a model? I mean,
that's an actual model. That's exactly what a patient gets.
My hands are a little
you can
greasy.
see that can be so tight. In fact, my patients, we can make this so tight, I actually make an instrument for them to get it out. There's this little tool, they just pop it out because they have trouble getting it out with just their hands.
So 2 implants for the denture. And they could eat and chew. I mean, could they eat corn on the cob? They could
just 2 implants changes their life. They can eat corn on the cob, they can hold their teeth, they have more comfort, and it saves their bone. And that's one of the big things that people don't talk about is when you don't have teeth, every day biting on the bone goes away.
Is that right?
When you have a dental implant, it's similar to like a door stop. Instead of the door smacking into the wall, it hits the implant and it holds the bone where it is versus like a door hitting the little door stop. It's the same type of situation. The implant helps preserve the bone, and it gives something to grab to help hold their teeth in. And a next level of this is a bar where we can do 4 implants, and we can make a bar, and that can give them even more.
So 4 implants on the bottom.
4 implants on the bottom or the top, and we can make.
We're talking about snapping in, snapping out.
We're talking about snap in, snap out, and on the bottom it can snap in. On the top you can do this also and have a U-shaped denture. Doesn't have that palate covered, all that discomfort. There's a number of patients, they don't taste as well, they don't feel temperature as well, and they have that big bulky thing in their palate that really bothers them.
Is this one of those things where the patients will say, I should have done this years ago? Do they say that?
Our patients say, they always say that continuously. They say, I wish I did this 10 years ago, 20 years ago, 30 years ago, because they didn't realize what was available, and they heard horror stories from other people that weren't true. And now when they have it, it's just tremendous.
So you really can't be too old then for dental implants?
No, and I would, if a patient has good health, they can have an implant.
80s, 90s, they're doing it?
I have personally patients in their 90s that we place dental implants, and I've heard of patients in their upper 90s with having implants placed.
Give me a time frame. Okay, so a denture wearer is watching this. You say teeth in a day. If everything goes right, okay, 70-year-old wearing dentures, from today's date or whenever they're watching this, how soon would they have teeth in their mouth?
Well, it takes about, I could do it in a week from start to finish and have teeth in their mouth, where they go home with the teeth. I mean, we have to meet them, we have to design it, and then my technician works with me, and we.
It's like 2 weeks to 30 days, though.
Yes,
is fair on average.
For the teeth in a day, 2 weeks is probably our average.
Is that right?
From start to finish.
So just a few visits to the dentist, and they got a fixed set of teeth that they could go eat and chew and all of those things.
That's exactly true.
Okay, so the next model is what? Is that what we're talking about? That's fixed?
This is what my patients tell me is the best. The ones that go for this.
What is it? What is it?
This is an all-on-4. The implants are placed in a certain way where we can get bone. In fact, patients are told you don't have enough bone to do implants. With this technique, we can place it on almost every patient. We can find enough bone to do implants. But it's a trick that was really started by someone in Portugal, Dr. Paulo Malo. He started the technique and published it after 10 years, and now he's had thousands of
You lecture on this topic, this all-on-4?
Yes, I lecture.
And it's a fixed set of teeth with 4 dental implants.
Yes, just 4 dental implants, and with a success rate the same as 9 implants, the same as 8.
And they could eat, they could
and
chew.
Dentists don't believe this. I lectured just a week or so ago on this to dentists, and they were all like, I can't believe it. It can't work. It can't be true.
Is that right?
But now we have the statistics. We have the patients. We have actually thousands and thousands of patients now around the world that have had this done, and it works. It works great.
Well, I think there's no doubt about it. I mean, people want something that doesn't have to come in and out of their mouth, no matter what.
This is the best because you just said it. It doesn't come out of their mouth at all. It's the most comfortable. It doesn't sit on their gums at all. This is teeth to them.
So and we're almost out of time, okay, but in Arizona alone, would you say there's thousands, tens of thousands of people wearing dentures, an upper or a lower denture, that could benefit from this?
At least, probably more than, there's probably hundreds of thousands of people in Arizona itself that are wearing dentures to think that, that's not me. I can't do that. They think I've had dentures, I've been wearing them, and I'm too old. I can't do it. I don't have enough bone.
Pain, though. But pain. You're saying pain's not an issue.
Pain's not an issue at all.
Right?
These are the things that almost horrify me that the patients think this. It's not true. All these people, I wish they would see someone and have something done because it can change their life.
So the surgery's done on a computer? I mean, you pre-plan this surgery?
I have guided surgeries that we plan on the computer, and we make the teeth before we even do it. And then we place the implants in and the teeth the same day. Just
same day.
Exactly where we plan it.
You showed me a picture in our green room. You said morning, evening. It's that simple.
Well, with the guide, I can do it in 1 hour. Put it in their mouth, but I also have techniques if they have teeth or if there has to be any change made because they're a little off with bone or something. We can still do it within a day.
Okay. And do you think? And there isn't. And people just tuning in. We're talking about. Teeth in a day, teeth in an hour. We're talking about all-on-4 dental implants. So if you have a loose-fitting denture, as little as 2 implants, something snap in, snap out. I want to recap. 4, you can give them something fixed. You're saying 80-year-olds are getting this done. Is it more men, more women probably doing this procedure that you see?
Well, I could do this for men and women.
But I mean, what do you see as far as
I see more women than men.
Because men put it off?
Men like to tough it out. They like to tell, I'm okay, I can eat anything, even when they can't. My own grandfather had dentures. They were miserable. He lived to 97. I went to see him in a nursing home, and he didn't want me to play. He said, I'm okay. And I looked in his mouth. His gums were sore. There's no way he could wear those teeth well. He just was miserable, but he didn't want to say it, because men can be like that. They don't want to complain. I don't want my wife to know I'm uncomfortable, and he worried about her. He probably would have invested on her, but not on himself. In
a tough economy, though, why do something like this?
Well,
why invest in your smile?
Well, frankly, you need your teeth your whole life. You need it to support your face. You need it to be able to go smile. You need it to be able to eat. And you mentioned tough economy. As you get older, for your health, and people are living longer than ever, you need to get nutrition. You need to eat vegetables like broccoli. You need to be able to keep your health up. And without having good teeth, you can't do it. And so getting dental implants allows the people to have better health. It gives them, it's a great investment. And more importantly than investment, it changes their life by having something in their mouth that stays there, that's comfortable, that lets them go out and be at the family picnic or with their friends and enjoy life.
Do you hear stories? I mean, do patients come in and want to brag to you what they're eating? I mean, does that ever happen? Or they say, "Oh, doc, I gained 10 pounds because I'm eating again."
All the time. The patients,
really,
they sometimes they'll complain that they're gaining weight now because they can eat so well. And I tell them to go work out.
Are there people that say it helps their social life, their personal life?
Oh, absolutely. All our patients, when you get self-esteem, it helps you for everyone. If you feel good about yourself, you do better in life, and when they do this type of work, they feel better. I say patient, but these are people. Many of these people become friends and become advocates for my office, advocates for other people to go do this because they realize what a transformation is in their lives.
So if somebody wants to find out more, and we are completely out of time, final message: somebody watching this, they're a denture wearer, they're missing teeth, or maybe they, like some of your photos, they haven't been to the dentist in 15 years. What do you say to them?
Well, come to the dentist. Come see me.
Okay.
See me tomorrow or today, because I can change your life, and this is a chance for you to come and have the smile you've always wanted.
Now, we are completely out of time, but your website is very unique. And I always think when dentists come on my show, you guys are exaggerating about how a smile can make such a big difference. But on your website, it drives home the point, because you have this interesting technology.
You've seen our before and afters.
Yeah, before and after. You have their face cut, and you slide it, and you see what the smile and what it does. So good for you. Very interesting.
It's great.
So go to the website.
I like looking at it. You can really see how they look before and then after, and what we can do, and it's exciting to see the changes and what people, how they look totally different.
Okay, good. Well, I want to thank you for coming on the show. Very interesting. Good stuff.
Thank you for having me.
Good information. They could follow you on Twitter. You're probably on Facebook too, is that right?
Twitter, and TucsonSmile.com.
All right. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to watch this interview again online, we'll have it on our website at wellnesshour.com. Just put in Dr. Steinberg, or you could put in Dental Implants, Arizona. You'll find them there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.